Okay, we're live, and hi, it's Elliot Fishman. Wearing my jacket here. Hope everybody's doing okay. It's a Friday. I was away. I was speaking and moderating at the ESI Cutting Edge Body CT course in Las Vegas since Tuesday, Wednesday, Thursday. Came back last night. Terrific meeting, I think. We had really good speakers. Linda Chu from Hopkins, Charlie White from University of Maryland, Barry Dane from NYU, Jan Fritz from NYU, Brian, I'll kill his name, Ganara, well, Brian, who's excellent, stupendous in cardiac imaging from Mass General. So I think we had a really good group of speakers. Um, so that was a lot of fun. Came back yesterday. I didn't even walk around Las Vegas. I didn't even gamble really. Just was not in the mood to gamble. We were at the RA Nice Hotel. And ESI runs meetings very nicely, but you can see how everything in radiology is moving forward. People complain, but what I noticed was a lot of the NYU's and Maryland's and Mass Generals, very minimal complaints. I think everyone's looking for people, everyone's busy, but I think everyone is excited about academics and the potential, so that part's really good. Um, it's interesting. I flew back from Vegas. I mentioned I could swear since I used to go to Vegas a lot. I haven't been to Vegas for meetings, not for gambling. I haven't been to Vegas since well, maybe one time. One time I was since the COVID era. It seemed to me that the flight took forever coming home. I have not been, it seemed like Las Vegas is further than it used to be from Baltimore. I know that's not the case. Don't worry about it. But and before that, I was at the UCSD, University of California, San Diego. Meg Richmond has run a course that I've spoken at very kindly. They invited me for the past 20 or so years. So I spoke there like 6 times Monday morning. I haven't given 6 45-minute talks in a row, or it was a coffee break. I had a cough. Those of you who watch these live videos, I had this cough. Everyone on the East Coast had this cough for a couple of weeks. Fortunately, the cough ended before I went to California. So San Diego is very pretty. So that's my travels. Now, one of the things I've noticed in traveling and reading both the radiology literature, but especially the non-radiology literature, and reading notes from friends who are outside of medicine, one of the hot things these days, liquid biopsy. Liquid biopsy, you have GRAIL, you have Exact Science, tremendous potential. So people speak to me about that. You now can get both tests from your clinician through labs very easily. It looks like it has really good results, and we can talk about liquid biopsies at a different time, and I won't go through what's better, who knows, but really good results have been published. Recently, GRAIL published some really good results. There's a big trial coming out from England. There's Exact Sciences coming out with big numbers soon. So that's all going. And a lot of people who are a bit older ask me about these liquid biopsies, and I'm very, very positive about them. I think typically, here's the numbers. If you have 100 people, 97% are negative, 3% are positive. Out of the 3%, 3 out of 4 patients, if it's positive, will have a tumor, typically low grade, and the fourth person will be a false positive. The biggest challenge is the false positives. How far do you pursue that? We get a CT on all the positives, then maybe a PET after if necessary. But there will be a small percent of patients, under 1%, that will have a positive study with nothing there. Maybe you'll follow them again in a year, but it's going to be hard to have no false positives, right? But it's a small percent, so I think that's very exciting. The other thing that's gotten a lot of press in the lay press, you can ask Kim Kardashian or some of the other celebrities, but also a lot of press and a lot of contact among people who can afford the test, is this whole body MR. Now, the whole body MR, there's a couple companies that I won't mention names, But typically what it is, a whole body MR where 2,500 bucks, and they give you this 20-page report. Now, of course, there is an article, and I won't go into that either, where there was a whole body MR someone had, and they missed AV malformation in the brain, and the patient then had a stroke like a month or 3 weeks after the MR, which was read as negative. It's a big lawsuit, and I don't know what's going to happen. I don't really look at lawsuits. But the challenge, of course, with the MR, it's a single sequence of everything. So the truth is you can overcall and undercall. I've yet to see one of those MR studies be negative. They always mention something, and then the patients get very anxious, which leads to more studies. People speak to me about the whole body MR, and I say to them, well, I can't stop you and you can afford it, but what's going to happen is you'll go get it, and then you're going to call me up because something was positive, and then I'm going to have to get you more studies to show it's really negative. So that's the problem. It made me think of whole body CT. For a while, we were doing whole body CT scanners, and the truth of the matter is, I think body CT with contrast as a screening tool is really excellent. We had a 3% false positive rate. You can pick up a lot of things, from renal tumors to liver tumors, pancreas, lung, bowel. There's so much pathology, both cancer, inflammatory disease, degenerative disease, vascular disease. If you smoked, looking at your lung, calcium scoring, coronary artery evaluation, aortic evaluation. We did that whole body scanning 20 years ago when scanners weren't as fast or as good as they are now. But when you look at things like photon scanning, we could do a whole scan of your body and look at your coronaries, your valves, your aorta, plus your liver, pancreas, kidneys, lungs, spleen, and everything else. So I was wondering, particularly as doses get lower and lower, are we going to enter the era where people bring up, should we do whole body scanning? Now, of course, the first thing that people will say is, well, this radiation dose, which there is. MR has no radiation dose. But if MR is going to have a lot of false positives and lead to many more studies, would CT be an option? It's an interesting question. If they ask me, is it going to happen? I would say no, because nobody is going to invest in doing whole body CT scanning. Or maybe after this talk they will. Whole body MR, there's a couple companies, there's a lot of venture capital money, there's a lot of celebrities, so it has some momentum. Now, will the momentum continue? That's a different question, because the problem is that if you always have these false positives, and of course someone I saw in People magazine or something, and it came across my phone, that this person's female actress, can't think of her name, said, oh, I had a whole body MR and they found a pancreatic lesion that they resected. Now, I'm not sure what the pancreatic lesion was. Was it simply a cyst or something more ominous? I don't know. But be aware of whole body MR, read about it, think about it, because patients will ask you about it. And then I'm just making sure that you also think about whole body CT. I'm not telling you to do it, far from that. I'm just bringing back the memories of whole body CT. And if we decided to do whole body screening, what should the modality be and what should the protocols be? It's kind of interesting. It's interesting to think about, and we'll see what happens. Anyway, I hope everybody is doing well. Today's Friday, so if you're not working, or even if you are working, have a great weekend and a great rest of the Friday. And for those of you with kids or anybody, happy Halloween. I almost forgot. And give those trick-or-treaters some good candy. Okay? Have a great day, everybody.